Effects of cold modality application with static and intermittent pneumatic compression on tissue temperature and systemic cardiovascular response. We all know that cryotherapy decreases pain, slows the nerve conduction velocity, and decreases tissue metabolic rate. However, external compression with cryotherapy can increase the cooling on the surface as well as intramuscularly. Game readies used in the experiment basically just provide continuous circulation of the ice water with intermittent compression, and it is unknown if this combo can further decrease the temperature while causing an increase in the cardiovascular strain. The purpose of the experiment was to investigate the cardiovascular response and the tissue temperature decrease of common cryotherapy techniques and intermittent pneumatic compression combined. The methods was to use 10 subjects between the ages of 20 and 26 with no current or recent lower limb injury within 4 cryo sessions that consisted of 30 minutes of treatment, 30 minutes of recovery, including ice bags as a control, game ready with no compression, and then game ready with medium and high compression. While in these sessions, temperature was measured orally on a skin surface and intramuscularly through the quad. Mean arterial pressure, heart rate, rate pressure production, forearm blood flow, and forearm vascular conductance were also measured during each session. Baselines were measured prior to the sessions while laying supine at rest for 30 minutes. The temperature was taken every 5 seconds for 30 minutes. Heart rate was continuously taken. Blood flow had a baseline, and then it ranged between every 30 seconds to every 5 to 10 minutes. And then the forearm blood flow is every 3 to 5 seconds. The results are shown in these two graphs. The one on the left shows that the no compression game ready had significantly less effect on the muscle cooling than any of the other modalities, and also shows that the ice bags shown in red provided the greatest muscular cooling. In the graph on the right, we can also see that ice bags provided the greatest skin cooling, but all the modalities were equal in the immediate warming of the skin and muscle after removal. The results of the experiment were that the no compression game ready was least effective at cooling the muscle tissue, and the medium and high game ready compressions being greater for the intermuscular temperature may be due to the compression, the intermittent compression increasing the surface area of the cooling. The conclusions of the experiment were that while cryotherapy benefits are said to be due to the decrease in tissue temperature, there was little evidence to show a large significant difference with the cryotherapy that we used. However, the use of cryotherapy and intermittent compression at both levels did achieve adequate intermuscular cooling. The clinically significant temperature reductions occurred within 5 minutes using the ice pack and 10 to 15 minutes using a game ready. Cryotherapy used in combination with intermittent pneumatic compression may be adequate in achieving significant intermuscular cooling in young and healthy individuals. My issues with this trial were that only 10 subjects were used. They were all healthy and young, and all the tests were performed at rest. For future studies, more subjects would increase the accuracy for a greater population. Injured individuals will allow us to study the effects on injured tissue and the inflammation process. And using athletes or active individuals allow us to study the effects on post-game practice or post-activity response with the differentiating chemical levels that our body has at those times. Citations.